Hi, I'm Dr. Brett Belchitz. I'm one of the physicians on Maple. One of the most common questions we get here on Maple from our patients is how can we diagnose common bacterial infections without a physical hands-on examination and without laboratory testing? So a great example of how we can do this comes from urinary tract infections, or UTIs for short. So urinary tract infections are actually the most common bacterial infection in women, and they affect about 500,000 Canadians every single year. The symptoms of these are things that most women are familiar with. So it's frequency of urination, burning with urination, and cloudy or foul smelling urine. And so there's actually lots of evidence to show that history is really the most important tool in properly diagnosing a urinary tract infection. And there's great research and guidelines that show that for women who regularly get urinary tract infection, their ability to recognize the diagnosis is just as good as laboratory testing. And because of that, the guidelines say that physicians can actually, for women who regularly get these types of infections, diagnose and treat them completely by telephone. So you can imagine that if it's safe to treat these kinds of infections by telephone, it's even better to treat them by video, where we can actually visually assess the patient that we're talking to and make sure that there's nothing else that we should be worried about that you might not pick up on during a telephone call. So for women out there with urinary tract infections, those horrible symptoms that come on regularly, you can come onto Maple, you can skip the trip across town and the hours in the waiting room and potentially a delay in treatment and get yourself treated right away. And you may have a better outcome because you're missing a delay in diagnosis and treatment. I'm Dr. Brett Belchetz. I hope you found this video helpful.